The number of incidents resulting in death in public hospitals has increased by 39.3% in 4 years, while the number of surgeries also saw a peak increase of 81.5%, according to data from the Ministry of Health. A report in the Bugün Daily on Friday referred to the public hospitals' annual statistics released by the Ministry of Health and said that the number of people who died in state hospitals rose from 83,866 in 2010 to 116,866 in 2014, an increase of 39.3%. While the ministry's annual statistics report did not give reasons for the significant increase, Bugün said that in contrast to a decrease in all types of deaths across Turkey, the number of deceased patients in state hospitals increased by 40% in 4 years. During the same period, between 2010 and 2014, the ratio of those under the age of 65 who had died decreased from 34% to 31.4%. The number of some other medical services provided by public hospitals also increased during the same 4-year period. The total number of clinical examinations in state hospitals increased by 24.2% between 2010 and 2014, while the number of inmates and emergency patients increased by 18.7% and 17.7%, respectively. There was also a more significant increase, 81.5%, in the number of surgeries. In 2002, the total number of surgical operations was recorded at 2 million. Whereas the most recent data presented by the public hospitals' annual statistics show that this figure had increased by 7 times to approximately 14 million by 2014. State hospitals accounted for 10 million of this figure. The Bugün report quoted Turkish Medical Association, TBB, Secretary General Beyaz Ilhan as saying that either the increased number of inmates and surgeries in public hospitals or the time that a patient spends in a hospital indicates a problem in the public hospital's performance system. While commenting on the public hospital's points system, which distributes a hospital's monthly revenue to doctors according to the number of examinations and surgeries they perform, Ilhan was quoted as saying, "The double increase in the number of surgeries within 4 years can never be explained with science or with people's need for such medical services." Ilhan added, "This is all about the problems in our healthcare system. Such an annual increase in the number of public medical services, particularly in surgeries, is never seen in developed countries. This increase cannot be presented as something scientific.